Hello, dear participants of the conference. My speech will be about how we implement the basic functionality of the 1S hospital system to create electronic medical records and store them in digital form for neurosurgical department of medical center. The purpose of the study is to share our experience of applying formalized electronic medical documents in the management of patients of the neurosurgical department of the medical center. The study can give a positive result in the applying of formalized electronic medical records to reduce errors in patient management, speed up the treatment process, and improve the quality of medical care. The corresponding tasks are presented on the slide. This problem of objectivization of these techniques is relevant for neurosurgeons and other specialists working in the department, as well for the statistics department. To solve this problem, we propose the use of formalized electronic medical documents, which will speed up the process of documentation and improve the quality of the description of diseases of patients with severe neurological symptoms. We are confident that the introduction of such a system in the neurosurgical department of the Medical Center of the Far Eastern Federal University in Vladivostok will be an important step in the development of neurosurgery and improving the quality medical care for patients with severe neurological symptoms. To assess the condition of patients, we apply different scales and compare the results over time. We study the results of patient management in the 1S hospital system, applying various scales to improve the quality of medical care and treatment of patients. As an example, we use different scales and compare the results over time of patients suffering from vertebrogenic radiculopathy. The slide shows the complaints and the history of the disease common to doctors of all medical specialties. Those who were a year ago remember that our project had a general structure of the document for doctors of therapeutic department aligned with the manual of electronic medical document management. For an outpatient appointment with a neurosurgeon, the section also remained unchanged. The only difference is that it is possible to add information about an objective study of the neuropsychiatric system. This slide presents both of parameters addressing the main cranial nerves and cognitive abilities and memory preservation of patients. For the latter, mental status assessment scale is used, which is presented in the form of questionnaire. The doctor asks to perform the necessary actions and, depending on the quality of their performance, concludes that cognitive function is preserved. The pain detector rating scale is also used to account for patients with neuropathy. In it, depending on the sensations of patients and the localization and type of pain, an objective sign of the influence of pain is created. In addition, we have also introduced additional scales to access the functions of attention and cognitive functions of patients. The introduction of patients in the neurosurgical department has become more effective due to the applying of various scales to assess the severity of the disease and choose the optimal treatment pain. Thanks to this, the treatment process has become more efficient and the patient care has become better. So a list of references is presented on the screen. Thank you for your attention. Goodbye.